Hello everyone. I'd like to talk about global impact of COVID-19 and how to do. Whether rich or poor, all nations of the world have gone through COVID-19 pandemic disaster. What's the COVID-19? It's one of the coronaviruses like SARS or MERS, which are respiratory syndrome by doing harm our lungs. Until December, we've only heard of 6 coronaviruses. COVID-19 is the 7th. It's new to us and it just had its gene sequencing. That's why it's novel. Coronaviruses are zoonotic. That means they transmit from animals to people. COVID-19 most likely escaped from animals to people at a wild animal market in Wuhan, China. COVID-19 is not the last major outbreak in that it's a given, not a maybe. Human choices are driving us into a position where the climate change makes the world more hospitable to viruses and bacteria, and also when you're converting rainforests of Amazon to farms, wild animals are hunted to extinction, and human beings coming into contact with wildlife populations that they've never met before, and those populations have new kinds of diseases and bacteria we are not ready for. Bats in particular are the host of the illnesses that can affect people, but they are not the only animals that do that. So, as long as we keep making our remote places less remote, the outbreaks are going to keep coming. International cooperation is crucial to face this global challenge resulted from man-made output. However, we've been put into a lack of global health governance. WHO seems to have failed on its leadership, with political strife between the US and China. Also, it's nearly collapsed after the resignation of WHO's heads, who are allegedly sided with China, and the US exit from the organization amid growing tensions in public health and global economy, and an expectation that it's going to get worse globally. Then, how can we prepare for the next deadly viruses, as well as ongoing COVID-19? We can't stop the outbreaks with quarantine or travel restrictions. Nobody knows they need quarantine without symptoms or signs. Also, humans are social animals, so they don't want to be separated from their families or friends. These factors may trigger evasion, dishonesty, and concealment of real information that all makes so difficult to track a disease outbreak. In this situation, we need a one-way approach to health. It can be accomplished through the knowledge integration, with the whole world connected via elements like internet to yield added value from collective strength of human, animal, and environmental health systems to enable their cooperation and collaboration to address any threats at the human, animal, and environment interface for effective prevention, detection, response, and recovery. To do so, we must openly share and work together. Please don't let us frustrated by the destructive virus, but illuminated with billions of hearts and minds working in unity. Thank you.